Hi, I'm Greg Hunter. Welcome to USAWatchdog.com. With us today is Karl Denninger, of market-ticker.org. Sir, thank you for joining us today on USAWatchdog.com.
Anytime, Greg. What's up?
Well, months ago you were talking about Obamacare, and I was having a hard time finding people who've really studied it. And you're an analyst, you're a trader, professional trader. You're also in the on the cable TV, computer, internet type businesses in the past, and you also are a journalist, writer. You've been really looking at the healthcare system. Months ago, you told me it was going to be a disaster, and voila. Disaster is upon us. Earlier this week, the president brought out somebody from Delaware to talk about his health care program, and it was somebody with a pre-existing condition. Now, bless these people that, they have pre-existing conditions and they have care, but that's not what he needs to make this fly, according to you. Tell me about what you think about this program. I know the rollout's rocky, but farther beyond that, what do you think?
Well, there's a couple of problems. The biggest issue that this system has is what's called adverse selection, and that's why there's a fine if you don't participate, because if you can't solve the adverse selection problem, then the entire system collapses. And essentially what adverse selection is if you're an insurance company and you only sell insurance to people who have already lit their house on fire, you're not going to be in business for very long. So you have to have conditions. Yeah, you have to have a lot of people who buy insurance that are not likely to have fires, all right? Because otherwise, if you're selling fire insurance to only guys who store 50 gallons of gasoline in their living room in mason jars, you're going to go bankrupt. And the problem that we have in the so-called insurance system today is that it's not insurance. You have, first off, there's no compulsion to buy it, but there shouldn't be a compulsion to buy insurance against something, because you buy insurance against something that is unlikely but will ruin you if it happens. All right, so you buy auto insurance because you can't afford to replace your automobile if you crash it. If you have enough money to replace your automobile, it's not worth very much. Then the only thing you need insurance against is the possibility that you might do $1 million worth of harm to someone else while you're driving as a result of something you did. You don't need insurance against the value of the vehicle being destroyed because you really don't care one way or another. You'll either buy a new one or it's not worth replacing in the first place. With health insurance, the argument is everybody will use health care at some point in time. That's true, but there is no claim that can be made that everyone will use health care they can't afford to buy at some point in time. So what we've done is built a system that is predicated on monopoly control of pricing such that it intentionally bankrupts anybody that doesn't buy these insurance products, and then you force everybody to do it. And when the insurance industry ran out of ways to make this scam work, because younger people simply said, you know what, the odds of me getting seriously ill where I'm going to need this is 0.1%. I'll roll the dice because the cost is too high.
Well, What the president needed was, instead of having somebody with to make his system work, God bless the people with pre-existing conditions, but to make his system work, he needs, 22-year-old Sally Smith that says, hey, I'm healthy as a horse, and I'm not going to need health care for, unless I have a car wreck, and I'm willing to pay $85 each and every month to help out my president. Is that going to happen?
No, and the reason is that even if you have a car wreck, your car insurance has PIP protection in it in most states, which is injury protections for exactly that reason, is you might have a injury as a result of a car wreck. So what you're basically doing is the insurance companies, along with the rest of the medical industry, has run this extraction scam, which is essentially an extortion racket. It's legal, but it's an extortion racket for the last 20 or 30 years. And as they've done so, they've ratcheted up ever higher the amount of GDP that they take in as a percentage. As they did that, younger people have said, I'm not going to participate in paying into this in advance because financially it doesn't make any sense. Okay, the actuarial risk of me needing this doesn't justify the cost. Now Obamacare comes along and says, I'm going to shove a gun up your butt and make you buy it under pain of a fine because it's the only way to continue the scam. All right, so Obamacare is not about covering people. It's about force. It is about forcing people to make uneconomic decisions because the cartels in the medical industry have run out of the ability to do so by any means other than force. So what you've got now is a system that rolls out that doesn't work. All right. So now Sally, the 20-year-old, tries to go online to find out how bad this is really going to be with the subsidies and the cost shifting and all the other things, and she can't get a price. She's healthy. She has no reason on God's green earth to come back. So this makes the problem 100 times worse, because the only person who's going to sit there in front of the computer and hammer on that enter key and that mouse click to try to get through is the guy that has AIDS, because he desperately needs health care. The person who doesn't need health care, they'll try once, maybe twice. After that, they're going to say, you know what, bite me, and they walk away. Now you've got a huge problem, because the only people that enroll are the people that are going to crash the system if everyone else doesn't show up. So my guess is that of the people who have enrolled, the vast majority of them are those that are very heavy users. Now let me add to that a little bit. One of the things that I found out about just shortly before the site launched, because we had the so-called navigators coming around in our area talking to us about how wonderful this plan was, and we were all going to benefit, this and that and everything. Well, a friend of mine went to one of their meetings and found out that there's only one company in our county that's going to sell these policies. Now, you used to be able to buy health insurance across your entire state. All right, you couldn't buy outside your state, but you could buy across the entire state. And there were typically a couple of dozen companies that sold policies. Even in a state like Florida, we have several million residents. But even in a state like Florida that has really weird insurance-related laws, there were still a half dozen firms that you could buy health policies from. There is exactly one in my county that I can buy a policy from under Obamacare. It's split into both a PPO and HMO, but it's one firm. It's Blue Cross. That's it. So just recently in the last few days, they changed the site. You used to have to register to get a price. Now you can actually browse first, but it won't tell you what subsidies you might get. It just gives you the price. So I went and I looked. I currently have a catastrophic policy. That's all it covers. And in another year or year and a half, it will become ineligible because it doesn't cover all the things that Obamacare says it has to cover. For example, it doesn't cover maternity for me. Now, I can't imagine why I would need maternity coverage, but Obamacare says I, as a man, have to have maternity coverage because someday I might have an artificial uterus and have a baby. So this coverage has to be included in the policy. Well, in my catastrophic policy, maternity is not covered. Of course, as a man, I would never have a need for maternity coverage in the first place. So that policy is, because it renewed prior to the end of the year, it is okay for them to continue to offer it for next year. But after that, it will disappear like a pumpkin. And people are already starting to get these letters saying that your coverage is going to be non-renewed, and this is why. So I went and I looked at the price. Would you believe, and I found this hard to believe, that the bronze plan that has these additional coverages, but it has potentially higher out-of-pocket costs than my CAT policy, because as a catastrophic policy, that's what it is. It's in case of catastrophe. I cover a substantial amount of the money, and if it happens. It's actually cheaper for me as a 50-year-old to buy an Obamacare policy than it is to keep my CAT policy. Not by a lot, but it is. It's cheaper. Now, I'm healthy. I have no pre-existing conditions. I don't have diabetes. I don't have an elevated A1C. I don't have cancer. I have no history of any of these nasty diseases in my past. My medical record is clean. And that's the basis under which my CAT policy was underwritten. So if it's cheaper for me, and I'm a nominally healthy 50-year-old guy, how much more does the 20-year-old have to get screwed blind in order to cover the implied subsidy that's in my price? Because it's large. My current policy is personally and medically underwritten. It was at the time it was issued. So I'm in the low-risk part of the curve, although based on age I'm not, of course, because I'm older now than I was when I got it. But this means that the young people, their policies are going to be absolutely outrageous. And what I haven't done is compare it against that, because I'm not 23, 25. I can't, I don't have a baseline policy from another company to compare against, but I can get those quotes. And I can tell you from when I ran my internet company that they are 400% and 500% higher than what I was being quoted for that coverage for people that were in my employ during that time. Because I've gone and I've looked at the numbers, and they're hideously more expensive. No one is going to willingly take that on.
Well, let's just say that the internet, which is, as the president says, not as smooth as I thought it should be. Okay, it was a disaster, but okay. What it comes down to is what you just talked about. How much do I get? What do I need? And how much do I have to pay for this? And you were telling me in the pre-interview the other day when I set this up, you said, hey, if enough young people don't get involved in this thing could implode before the end of the year. This whole thing could just...
It's not that it could, it will. Because
tell me about that. Tell me about why is it critical right now to get all these young people into the system?
The actuarial models under which these rates were set, that they're being sold at right now, these policies are being sold at, are predicated upon the uptake being substantial among those young people because they won't pay the fine. In other words, they'll choose to buy the insurance instead of paying the fine. If that does not happen for any reason whatsoever, you're going to end up with the only people in the group being similar to a particular person that I had working for me when I was running my company that cost my firm over $700 a month to insure. Now, this was not someone who was critically ill, but it was someone who had a couple of pre-existing conditions and was on a fairly expensive medication. And it was a $700 a month direct expense. When you look at, and that, by the way, is not the catastrophe situation of somebody who has a serious pre-existing condition that renders them unable to work, okay, or they're working but their health is real iffy, and someone, for example, has HIV, okay, where you've got the potential for a $20,000 or $30,000 a year expense coming back out of these programs. Well, the company cannot lose $20,000 per customer and stay in business. So what's going to happen is people are going to come into these exchanges with these pre-existing conditions. And if the young people do not show up, your first year coverage may cost you $400 or $500 a month, say, for example, for a relatively, and by the way, if you're a smoker, it's twice as bad, okay, because they can double the rates for smokers.
So wait a minute, let me just get this point clarified, Karl. If you're a smoker, they can charge you double.
Yeah, and that's one of the problems is that you've got two differentiating factors. One is whether you're a smoker, you use tobacco or not. And the second is your age, but there's a cap on the multiplier that can be applied for age. All right, and there's also a differential range that can be applied for smoking. And this is all set forth in the law. So this isn't about what the actuarial numbers show. This is about what the law says you have to charge. So what happens is this. Let's say that we don't get any 25-year-old healthy people that show up for the exchanges. All we have is sick 50-year-olds that have HIV, smoke, and or have cancer, okay, or have had cancer or some other serious health condition. Now, the next year, when these policies renew, the rates will double or more across the board because otherwise the company's going to go bankrupt. It is going to pay out more than it takes in premiums, and they will go bankrupt. Now, think about this if you're a 20-year-old. Let's say that your premium today under Obamacare is $200 a month, okay? And you say, well, gee, if I went and bought an individual policy, it'd be $50 a month, right? 4 times as expensive. Next year, it's $400. Are you going to sign up or are you going to pay the fine? Obviously, you're going to pay the fine, right? I mean, because at some point, someone's going to say, wait a minute, $4,000 for nothing? I don't think so.
Well,
and this is the way it's going to go down.
You were talking that if enough people don't sign up right now, forget about next year, that the whole thing could implode. Will you explain that to me?
Yeah.
Why it's so critical?
Well, sure. It's very simple. If you take in $10,000 worth of premiums as a company and you pay out $20,000 worth of benefits, you're out of business.
And so these payers, if they don't sign up in great numbers and early and often, you're saying you're not going to have to wait till next year. A lot of these plans will just go under. The whole system will go under.
Whole system will blow up, and then the final death throes of this will be that the companies will do everything in their power to prevent actually having to pay claims. So they will delay. If you go into the hospital and you get a cancer diagnosis, they'll say, well, we'll start your radiation treatment in 6 months. Well, you'll be dead in 6 months. All right. So, I mean, they will do everything in their power to, to avoid bankruptcy, obviously. But what's going to happen is you're not going to get what you bought, because you can't squeeze blood out of a stone. It's not possible to take that kind of red ink and put it on a balance sheet and stay in business. It won't happen. So this is the issue that you have, is that what Congress calculated rather coldly is that they could shove a gun up young people's backs and make them fork up the money. There were two problems with this analysis from the beginning. The first is they have no reason to buy today, okay? And the fine is an insufficient motivation because it is a small fraction of the premium. If I have to choose to pay the fine or buy coverage I'm not going to use, I will pay the fine, because the fine is less than buying something that has no value to me. All right, there's nothing complicated about that. It's easy. But the second problem, which is far more insidious, is that once you set this precedent, then what ends up happening is that the medical monopolies are able to expand to fill supply on price. So price goes up instead of down because competition has been destroyed. I no longer have 6 companies that could be potentially hammering the hospitals in my county to lower prices. I have one company that may very well conspire with the hospitals to raise prices, because now I have a vertical integration across the entire, panoply of healthcare. This is not going to bring down costs. This is going to accelerate costs. And so when you take those two things and you put them together, this is an extremely bad law. But, people say, well, it was wrong for the Republicans to focus on defunding this and getting rid of it because it was terribly destructive to the country and the economy and the political process, this and that and everything. And my answer to that is, look, if I know that an asteroid is going to hit the Earth, if I do not stop it now, if I allow this to continue another year, another 2 years, another whatever, there is a point at which no matter how much force I apply to that asteroid, I cannot modify its trajectory enough. It's going to hit the Earth anyway. All right? I have to get the force that I'm going to put on that asteroid on it far enough in advance so it misses. Once it gets within the distance where I can't change the outcome anymore, it doesn't matter what I do. So for those people who want to say that the Republicans made a huge tactical error in doing it, they're wrong. They were exactly right to focus on this. And the people who don't understand this don't understand arithmetic. We're not talking about complex mathematics here. This is arithmetic. You cannot sell fire insurance to people who say, I'm going to burn my house down when they come in to apply for it. Just like you can't sell car insurance to people who say, I come into the insurance office drunk. All right? And then sell them policies at a reasonable price because you know they're going to wreck their car on the way home. That's crazy.
Do you predict that the health care law will implode this year? Will the whole system implode this year? The Affordable Health Care Act and the system?
The system's destruction will be set in stone this year if these problems are not either deferred or immediately corrected. My guess is that somebody in the White House is going to turn around and delay the mandate for a year, which doesn't fix the problem. But they'll do that as a way to avoid what is otherwise going to be the destruction of pretty much every health insurance company in the United States.
Why didn't they do this in this fight? I mean, early on, they wanted to blame the Republicans for this, and I'm neither Democrat nor Republican. But I was thinking, boy, they just gave you a get-out-of-jail-free card, and they could say, well, we had the employer mandate, and we want to be fair to everybody, and we've decided to compromise and not shut the government down, and we're going to put off the individual mandate for a year as well. He would have avoided all this rollout. He would have avoided all this embarrassment. Now they've dug their heels in, and come 2014, the Republicans, to your point, are going to say, well, we said an asteroid was going to hit the Earth, and hello, it's here.
Here's the asteroid, right?
Yes, we did unpopular things, but we knew it was serious, and look what happened. Now they've dug their heels in so far, I don't know if the president can do an about-face. Do you think he can?
Well, you have a very arrogant man sitting in the White House. and he doesn't care, nor for that matter do Pelosi and Reid. Remember, this isn't just the president. If Nancy Pelosi and Harry Reid had gone to Obama and said, look, if we do this, we're dead, okay, as a country, not just politically, but as a country, we're dead, he would have backed off. So you had Harry Reid saying, we won't even take these bills up, these individual appropriation bills up. We won't even bring them to the Senate floor. We won't even vote them down. We just won't bring them up. All right. So, you know, you had cover coming from the left of the political aisle for Obama to do what he did. But remember, this is his signature bill. If this thing blows up in his face, and if you delay it for a year, you haven't solved the problem, because at the end of the day, the problem is the coercion is insufficient to assure compliance. And if you attempt to coerce at a level that does ensure compliance, what you've done is destroyed the purchasing power of the American public that we rely on for our economy to continue to maintain its health. All right. So, I mean, think about this, Greg, if you look at the average 20, 25-year-old, what is their actual disposable personal income over the space of a year? A couple $1,000s probably, right? After they pay their rent, their mortgage, their car insurance, all the other buy. A couple $1,000s, right? Most of those people are living on a couple $100 a month of, you know, I want to go out and party money. Okay? Now, yeah, there's exceptions. There are people who are, you know, making 150 grand a year. They're on Wall Street. They're, you know, hey man, let's rock and roll. But I'm talking about the average 20, 25-year-old has $100, $200 a month. You take $2,000 a year out of that person's pocket in the form of a fine, they have a negative disposable personal income. The consumer, believe it or not, the reason it's called a median income is because half the people make less than that.
You're saying that Obamacare, beyond it being a disaster, and expound on this, it's going to kill the economy. And that's what you said the last interview, that this is going to... So tell me, is this going to kill the economy, and why?
This is nothing other than a puerile and outrageous attempt to maintain a Ponzi scheme and a monopoly that the medical industry has foisted off on the American public over the space of the last 30 years. The only way to solve this problem, and if you do it, you solve all the fiscal problems that our state, local, and federal governments have all at once. You fix them all. You fix the budget deficit. You fix the state deficits. You fix the cities like Detroit that blew up over this kind of thing. You solve them all. You break the medical monopolies. You put the Sherman and Clayton Acts back into force for all industries, including them. So you cannot have price controls. You cannot prevent reimportation of drugs. You cannot do these things. All right. They all become the felonies that they're supposed to be, and that they are in virtually every other line of business. You start prosecuting people, put them in prison. The cost of medical care in this country comes down by 80 to 90% in a day. And we no longer need health insurance. And if you want to buy it for the unlikely event that you might get cancer, cancer treatment now costs $100,000 instead of $1 million or $500,000, and you can buy a catastrophic policy for $500 a year that will cover your risk of getting cancer. There is no reason on God's green earth why we can't have that back. When I was a youth, my parents walked into the local doctor's office and wrote a check for my annual physicals. There was no health insurance for things like that. You wrote a check. If I got sick and I had a prescription, they went to the pharmacy and they wrote a check. Why? Because they could. They were not rich. We were just lower middle class working stiffs. But it was not unaffordable. When did it become unaffordable? When you gave these people monopoly power. And we have to fix that. If we don't, all of these things break. Social Security disability goes broke in 2 years if we do not stop this right now. That is not a 20-year projection out. It goes broke in 2 years, and 2015.
And you think the economy crashes this year, and a big push over the cliff is going to be the Affordable Health Care Act or the Affordable Care Act?
It crashes this year or into next. I mean, the cracks are already showing up. If you take a look at some of the high flyers in the so-called faux luxury area of the economy, they're seeing massive collapse in same-store sales and operating margins Guess what, guys? That's all those people who live their life on credit. They don't really have anything, all right? But they are managing to keep their heads above water. And as their costs go up and their disposable personal income comes down, that collapses. Now you add the penalties or the mandatory insurance on top of that. Look, we have a government that claims in the CPI index that 0.6% of your household spending is health insurance. I'd like to know where these guys are getting the dope they're smoking. That stuff's illegal.
Karl Denninger, I wanted you to come in and explain the healthcare system and what it can do to the economy and what it is doing to the economy, and you have delivered, sir. Karl Denninger, market-ticker.org. Thank you so much for being on USAWatchdog.com.
Thank you.